The mayor's always been the one to say, Mayor, you can answer that question, and I know that one of the things you always said is that you would rather be more cautious than jumping into something.
I just want to make sure we're all safe and doing it safely.
Absolutely.
And we'd rather have that than, deal with it all over again.
Absolutely. Harry, other than does she know when it's going to end, do you have any other questions?
Well, do we have to, in each phase, do we have to wait 2 weeks?
Yes, you have to wait 2 weeks for the data. The incubation period, although it's extending now, I guess, is 2 weeks. So they like to see what the data looks like from the phase previous. If any of the data increases or we're not in those meeting the 7 criteria anymore, then they will talk about crawling back some of the freedoms that we are starting to gain. So it's 2 weeks in between. But if we didn't meet one, we don't have to wait 2 weeks to get there. We can, as soon as we reach those criteria points, then we can open up in the next phase.
Yeah. Well, the one thing, I just looked a little bit on the 2 weeks. It might be till the end of July, the way it looks right now.
For all the phases, yeah, you're correct. There's 4 phases, and 2 weeks between each one right now, Harry, yes.
Do you think we may have high school football in time?
You're asking me that? I sure hope so. LCTV's going to put their schedule out, hopefully that it will. And we're going to be there for those schools and for those sports if they need be. Even without fans, we'll still be there. So nice question.
Kids, you know what I mean? The kids have lost all their spring and summer sports already.
Yeah, the mayor, as a teacher, you know that. You see all these graduation ceremonies going on from elementary school, middle school, high school. It's tough.
I think the changes that have occurred with this virus and how it's now impacting children in a different way has changed how they were planning on reopening educational things and youth sports activities and those kinds of things. And I think they just want more research and more information before they make blanket decisions about the health and safety of everybody.
Yeah, Harry, I think the governor even said today something, ask me in July. So I think he's waiting
it's really
for
bad for I really feel bad for, like, myself as a senior citizen.
I do too.
Stop.
Yeah, well, hopefully you can get back out there and make up for some lost time, Harry, when you can.
Okay.
Thank you.
Good evening.
Yep.
Thank you.
He makes a good point. I mean, and Harry is a regular caller on the show, but he voiced a concern that a lot of seniors have, and a lot of kids have, and it's difficult. You want to see your mom, I want to see my dad, all that kind of stuff, but wait till the time's right.
Well, he made that point. It's hard, but he also said that you don't want to go too soon.
Right, absolutely. Okay, so we touched a little bit. Thank you about that, but we'll talk more about the numbers when we get more results on the numbers. But in the meantime, these things are the events that are getting canceled are just they hit home. We were just talking before the show. We cover a lot of those events that are being canceled. So,
and you guys are going to tape the small memorial service that the veterans are going to be doing.
Yes, I believe that's at Cold Springs
on Sunday.
They're only doing the one, right?
Yes, and it's very limited. They're not doing the 3-gun salute. They're only going to do their ceremonial words and laying of the wreath.
Yeah, it's always a touch. You know what? I think we just started sending the camera there maybe the last year or two, and we've always carried the parade. But those 2 ceremonies that they had are really what it was all about, and I'm glad to see that our cameras are going to be there again this year.
Yeah,
to bring that's something.
I was glad that they were able to do at least one thing.
And my dad's a World War II veteran. My thoughts will be with all the veterans and all the.
And the
veterans
problem is,
past.
many of the veterans are in that population of vulnerable people.
Yeah, they are.
And so we don't want to take any chances with them.
No, absolutely. I agree with you.
So it's limited to 10 people,
Mm-hmm.
and the 10 people are the people that are participating in the ceremony. So
And you can sit at your lounge chair at home and watch it. Either if you forget to watch it live.
I think he said it was going to be taped.
Oh, it's not going to be live. We're going to be taping it anyway, so it'll be on demand, and you'll be able to watch it at your leisure. And again, thank you to all the veterans out there as well. It'll be something that we really appreciate bringing to you. No doubt about it.
I know the VFW was putting the flags out at Glenwood last night.
Yeah, that's. That's pretty hard for all the organizations to put together things that they normally put together, especially when I'm getting emails from other places in other states that are saying, "Come on over," It's pretty tough. We got time is flying. You know what? Let's get into just a few things. We're going to talk a little bit about. I got a lot more things that we're not going to get into yet, but we got a new finance director, a new corporation counsel, and a new city clerk. We have those new. We might as well talk to them while they're new, because if I'm talking about them in a couple months, it'll be old. So, first of all, I'll let you do the talking. I know that the new city clerk, Rochelle Passeri, was let go, and they brought in Paul Oates. And then the corporation counsel, I knew that Dave Haylett left, and you brought in Lauren Miskell, and I've heard her doing very well on your.
And our deputy counsel, Pat McGrath, did our meeting last night.
Pat McGrath did a new deputy counsel too as well, and then you brought in a new finance director. Then tell us a little bit about those three, Timothy Russo too. So why don't you give us a little bit? Tell us a little bit about those three posts.
So Paul Oates, everybody knows from WLVL and through the city, and he was gracious enough to say that he would be willing to take on that role. He used to work in the county clerk's office, and so he has some experience in a clerk position.
Okay.
And he's been doing really well, and I appreciate he's learning the ropes, which is kind of good in one sense that we're closed, because it gives him an opportunity to not be bombarded with everything, although there's still a lot of things that we get bombarded
Yeah, I think
with.
Paul will be probably the first one to tell you that that's not really happening.
We still get calls.
Paul speaks his mind.
We still get calls complaining about refuse, and people still need to get their Medicare Part B and their prescription stuff taken care of. So he still has a lot to do, but it gives him a little bit of breathing room.
Now coming in though, Rochelle was dismissed. Is there anything new? Why did that happen? And then also into that, I know that there was a salary conflict, I guess, that was brought up at one of the council meetings with Paul's salary because of I guess you approved a salary or something like that. Tell us a little bit about that.
I do not discuss personnel issues.
Okay.
The salary, Paul agreed to a lower salary, and the council approved a salary on the budget for the city clerk.
Right.
And they approved it through a contract. And so we thought that meant that if it's not more than that, then it would be approved by them. Yeah. And I did not do a good job communicating with the council about the amount.
Okay. So it wasn't the original amount that you agreed, it was the amount that was budgeted for that position?
It's less.
Oh, it's less. Okay.
It's about $10,000 or $12,000 less than the budgeted amount.
Oh, okay.
So I didn't think there would be a issue.
Okay. All right.
But
Okay.
technically we didn't have the council vote again, because it's just for the position. So again, they approved that amount for the position.
There was a question of the position being a union position or a non-union position.
Either
right?
way, they approved it in the budget and in the contract.
Right. So I did see
And
that.
it's less than both of those.
Okay. The final number was less than what's budgeted for.
Yes.
Okay. Laura comes in. Lauren comes into the corporation council with a good mentor.
With her dad.
Yes.
Yeah, she's been doing a wonderful job.
Has she?
And she handles the meetings really well, I think, and has a good rapport with the council people. And we have a really good legal team for the city. They represent the city. They don't represent the mayor.
Okay.
The mayor appoints them.
Sure.
But they're there to represent the city, and they've all three of them are doing a good job.
Good. And then Tim Russo, he's jumps in as your new finance director. And let me before you talk a little bit about Tim. All three of them jumped into the middle, come in the middle of this pandemic. It's going to be pretty tough. We got about a minute, so why don't you tell us a little bit about Tim?
Tim's also doing a fantastic job, and it was the perfect time for him to come in because he's getting a handle on everything, and he's helping us navigate what we need to do for this. And we are going to do 2 budgets.
Okay.
We're going to do one that's COVID impact, and one that for next year.
For next year.
Yeah.
It'll be coming up. Well, we're going to talk a lot more about that. I have a whole half a page of city news that I want to get into. We will do that again when we meet again. But I want to thank you for taking the time out of your precious time that you have these days
Thank
to
you.
come out
And
here.
Thank you for making it a half hour later for me.
Nobody knows that.
Yes, they do. They know it's 7 o'clock on the third Thursday of
Lockport Community Television would like to salute all of the doctors, nurses, and first responders at Lockport's Eastern Niagara Hospital for their tireless service during this unusual and historic epidemic we're currently facing. Thank you for all you're doing to keep our community safe and healthy. Lockport Community Television would like to salute all of the doctors, nurses, and first responders at Lockport's Eastern Niagara Hospital for their tireless service during this unusual and historic epidemic we're currently facing. Thank you for all you're doing to keep our community safe and healthy.
Good afternoon, everyone. I'm Becky Widish, Chairman of the Niagara County Legislature. Thank you for joining us live on LCTV for our COVID-19 update. And we are also currently streaming live on lctv.net and 90.9 FM on your radio. Today, I'm pleased to be joined again by our Commissioner of Economic Development, Michael Casale, who's going to talk to us a little bit about our recent business reopenings here in Phase 1 in Western New York. But first, I would like to start with some very important recognition, given the times that we're living in, certainly. May 17th to the 23rd is the 46th annual National EMS Week. And today in particular is EMS Recognition Day. I think we realize how important these individuals are in our community at any given time, but certainly during something like we're going through right now, out there in the front lines every day working hard for us. Niagara County is home to 12 volunteer basic life support non-transporting fire agencies, 2 career basic life support non-transporting fire agencies, 16 volunteer advanced life support transporting fire agencies, 2 volunteer advanced life support transporting EMS agencies, and 2 career advanced life support non-transporting fire agencies. Just 3 of the emergency medical services are paid agencies, and the rest are volunteers. Now, my colleague, legislator Dave Godfrey, who served as a volunteer firefighter for over 2 decades, really captured how we all feel right now. David says, EMS personnel are truly on the front lines of every crisis, and COVID-19 is no different. To all of the women and men working in EMS who are always there when we need them, always there when we call, and are more concerned about the well-being of their neighbors than their own health, we offer a very heartfelt thank you. And we always want to remember to thank the families of these heroes who are at home supporting them as well. Very well said, David. From the entire community to the EMS personnel, thank you so very much for everything that you do for us. Now, for today's COVID-19 update, we have another 15 positive cases to report here in Niagara County, so that gives us a total of 936 positives to date. And those positives will include all of the individuals who are currently actively handling COVID-19, who are in isolation, all of the recoveries, and the deaths. We have 263 active cases. 248 of those are isolating at home, with 15 in the hospital. We have had no change in our number of deaths here in Niagara County today to announce, so we are still at a total of 59. And the best news that we get to report is that 614 individuals in Niagara County have recovered from COVID-19 and are doing well. Now, quarantines, unlike isolations, are for those individuals who came into contact with someone who tested positive for COVID-19. And they are well, they are not showing symptoms, but they do need to quarantine themselves, stay away from others, and make sure that if they do start to have concerns, that they're not spreading that throughout the community. So right now, we have 213 people who are in quarantine, with 739 who have completed that. Now, if you want to know more about your particular municipality, you can go to niagaracounty.com to the COVID-19 banner at the top of the page and see our heat map, which we update with the new numbers as they come in. Now, our heat map was updated again this morning, but I want to let you know that our mapping team will be off for the long weekend for the Memorial Day holiday, so that map will not be updated again until Tuesday morning. But please know that if we do have pertinent information to get out to you, we will do that through the press, the media, and we will also have it on our Niagara County Facebook page for you. Moving on to testing, the state COVID tracker tells us that now we've had 9,151 Niagara County residents tested here in Niagara County, and our infection rate has fallen below 10%. We are now at 9.6% infection rate of those tested. Now, you may remember not very long ago our infection rate was coming back at over 20%. So that is definitely a positive piece to hear and to know that we're headed in the right direction. As we test more people, we hope, of course, to see that infection rate still dropping. And by way of comparison, you should know that down in the New York City area, the counties surrounding the city are coming back at about a 20% infection rate, with some areas pushing as high as 30%. So 9.6 here in Niagara County, we are doing fairly well. Now, another reminder, of course, on that note, we are doing well with that rate, and we know that's because of all the sacrifices that we have made all along. We ask you to continue following those guidelines. Wear your masks, stay 6 feet apart, only go out if you truly need to or if you have to go to work at this time now. But very important to keep those things in mind, especially as we roll into a long, beautiful, sunny weekend. We've talked quite a bit about the expansion of testing here in our area, and I want you to know that the Niagara County Health Department has put together a list on their website which will show you all of the testing locations in Niagara County, and it will give you the phone numbers to call to find out what you need to do to go there. Now, of course, we know that most of these testing sites require pre-registration. Some of them require a prescription from your doctor, and each of those testing facilities, being run by a different entity, will have its own guidelines for who needs to be tested, who they can test, what they'll require from you. But we also know that the guidelines are very broad now. Most people can get tested. The governor does encourage everyone to be tested at this point. That is good for us to have for our data, again, to keep an eye on that infection rate. So I encourage you as well to call one of those numbers and find out if you can get yourself tested. Now again, we can see on the niagaracounty.com COVID-19 banner the link for that webpage, so it's very easy for you to find that list of testing sites, but you can also access that on the Public Health Department's website as well. We know that testing remains a key component in watching those metrics that we have to meet, that the governor has given us to have our businesses reopening here in Niagara County in the Western New York region as a whole. So again, I would like to welcome our Economic Development Commissioner, Michael Casale, to the show with us here today, so we can discuss a little bit about what we've learned this past week during our Phase 1 reopening. Mike, I want to start hot off the press. We saw a new executive order come out from the governor just this morning that had some new information about some loans that are available to our businesses here. Could you tell us a little bit about that, please?
Sure, and you're absolutely right, Becky. It literally is hot off the press just moments ago. The fund is called the New York Forward Loan Fund, and the governor has put $100 million into this fund, and Western New York is eligible for about $12.5 million of that for our small businesses. And this New York Forward Loan Fund is designed specifically for small businesses with 20 or fewer full-time equivalent employees, or FTEs as they're called. It's also made available to nonprofits and small landlords that can exhibit a loss of revenue because of what's been going on with COVID-19. And also, if you did not apply for SBA, PPP, or the disaster loan, you're eligible for this fund. And they're giving priority to regions right now that have already opened up. And the pre-application, by the way, all of this has been put on our website. And I like to, I want to toot the horn of my staff members because they're hot and busy and taking a lot of calls. And when we get information like this, it goes immediately up on our website on www.niagaracountybusiness.com. A link to the pre-application for this loan fund is already on our website. That reopening, I should say the pre-application process will begin at noontime on the 26th. So what day is that? Is that Tuesday or whatever day that is?
I believe so. I've lost track of the
days. The days are going one right to the other. I'm
Friday,
not sure. Right? But on May the 26th at 12 noon, the pre-app link will open up. So again, you can go to our website, click on that link, and start your application immediately. So that's a great fund. The interest rates are very, very good. 3% for small businesses and 2% for nonprofits, and the terms are 5-year terms. So it's a good program for the true, like we've talked about before, small businesses.
Wonderful. And again, that website that the Economic Development Department staff has put together is truly, truly a great wealth of information. If you have a business, if you're looking for information on whether it's those financial programs that you can tap into or the business reopening guidelines, they really have just about everything that you could need on that website. Don't hesitate to give them a call either. If you're having questions, they are available. Staff is working and answering phones to help you out during this time. Now, Mike, I'm sure that during this first week of Phase 1 reopening that your office has been very busy with phone calls and emails as people have questions. And I know that there are a lot of questions out there. I've been getting them myself from different businesses and residents. And the other legislators get that as well. I'd like to run through some of the more frequently asked questions that we know are coming in. I'll kind of ask you the question as if I'm that business owner or that resident, and you can respond and let us know where we can find the information that people are looking for.
Let her rip.
Okay, so let's say I have a business that I've been operating as an essential business before the May 19th Phase 1 reopening. So we've been working during New York pause. Do we still need to fill out the business affirmation online for the state?
The quick and easy answer is absolutely you do. And again, Kathy Sinor and my staff have been working hard. Go to our website. You can go to New York Forward, but we've got everything on our website. It's easier for you to go there. So go to NiagaraCountyBusiness.com and you'll see a red COVID-19 button. Click that button, and in the drop-down box, you'll see Business Reopening Guidelines. Scroll down to where it says Phased Plan to Reopen New York State. And you'll see the Phase 1 guidelines. Rich, thank you. Rich has put it on the screen. You can see all the way over to the right, there's a hot link for the business affirmation form. That business affirmation form is going to be the same form for all of the different phases. So what you need to do is you need to go on that website, click on that, fill out that affirmation form, and then submit. You'll click a submit button at the bottom, and you're all set to go.
Wonderful. And let's say, for example, I'm a trucking company. We want to submit our business affirmation form like we have to do, but we don't fit into any of the industry choices that are available yet. What should I do regarding my industry choice, and who do I submit my reopening plan to?
That is a very, very good question that we received, and I'm glad the person called and asked it, because there was no guidance that we were aware of. So we reached out at your suggestion, Becky, being in the control room, to Amanda Mays in Empire State Development. And she came back to let us know that there are no industry-specific guidelines yet for trucking or a logistics company. So at this time, the company should continue to ensure that they have a safety plan and are following essential business guidelines, and that plan is posted in their place of business. But there will be specific guidance released, and at that time, when the guidance is released, the company will need to go and affirm on that business affirmation that they've checked all the boxes, and then click submit, and you're good to go. So right now, continue to have your safety protocols up so that your employees can see it, any vendors that come in can see it, any customers can see it, and they know that you're doing whatever you can to keep them healthy and safe.
Great. Okay. And I can tell you I'm on that website multiple times a day, watching our metrics, watching the changes, and the state does update that page sometimes multiple times during the day. So if you're not seeing your industry yet, keep watching, check back daily, check on our economic development page as well. That is updated again. As soon as we see changes on the state website, Mike's staff has them updated almost immediately. So just keep watching. This one we get all the time. What reopening phase will my business be in?
That's a good question. And we get that. You're right. That, I think, is the biggest question.
Yes.
Again, up on our website, Becky, it'll list all the different phases. And I brought a copy with me so I can refer to it. I know it's going to be up on the screens in a couple of minutes, but it shows phase 2. That'll be the next phase. We're into phase 1 right now. And we all know what those companies are, what those industry sectors are: construction and manufacturing and wholesale trade and retail trade, agriculture, forestry, fishing. Phase 2 is listed. There are no guidelines yet for phase 2, 3, or 4, but phase 2 is professional services, financial and insurance, retail, administrative support, real estate, rental leasing. Phase 3 is restaurants and food service, hotels and accommodations. And phase 4 is arts, entertainment, recreation, and education. So I would suggest, and we also have this business reopening tool, a link to the business reopening tool, Becky, on our website. It's a great tool. You
Yes.
made us aware of it. As soon as it was made aware, we put, again, that up on our website. So go to our website and click on that New York Forward business reopening tool. It'll first ask you what county you're in. You fill that out. You're in Niagara County. Then it'll ask you for a NAICS code. Now, it gets a little tricky there on the NAICS code, so here's a little hint. If you're having trouble finding your NAICS code, Google it.
Yes.
If you're a fitness company, like a fitness or a gym, say fitness center, and just ask Google, what is the NAICS code for a fitness center? Google will answer. Then you take that 6-digit number, put it into the box, and it'll give you when your business can not when, but what phase you're going to be open in, or whether you can be open now. So that business reopening tool is a good tool, and again, it's on our website.
And again, a lot of those decisions not fully, whether they're not decided yet, they're not being announced by the governor just yet. A lot of specific businesses that people ask about that we just, even if you look up on that guide, won't show you just yet.
Right.
Even being in the regional control room, I can tell you that they don't give us a lot of answers yet about very specific businesses and what phase they will fall into. A lot of those decisions are still being made based on what they're seeing as other regions before us go through the phase 1 process. So really, again, we stress the point that you can check that website daily, even multiple times a day, for anything new that's come out. Okay, next question. Is there a specific date that I can point to for reopening my business so I can be prepared to reopen safely and in compliance with state guidelines?
Well, that's a tough question. If you take a look at where phase 1 opened, which was May 19th, and I believe we've been told that there will be 2 weeks between phase 1 and phase 2. Unless that's changed today.
Not as of yet. I don't have my regional control room call until later this afternoon. But really, there has been the constant phrase the governor uses is a 2-week waiting period to see how you're doing with your metrics between phases. Now, there isn't really a hard and set rule as to what will happen if those metrics are, if we go backwards, if our hospitalization numbers or infection rates start to head in the wrong direction yet. We haven't been told that there's a hard and fast rule as to, does that mean you just stop in the phase you're in and you can't move forward? Does that mean that you have to backtrack and maybe close down a little bit of what was open? We're not really being told that yet. Again, it's a day-to-day monitoring of the metrics, figuring out why that change has occurred, what's occurring, what we can do to fix it before a decision is made about moving forward. But the one thing we are told at this point is it appears as though we have to wait at least 2 weeks to be reconsidered to move to the next phase.
So that would be phase 2. So what I like to tell companies is, for your planning purposes, figure a worst case scenario. And a worst case scenario would be 2 weeks in between each phase. Although what I'm hearing is we do have to wait 2 weeks to get to phase 2. But when you get phase 2 reopened, it might not be 2 weeks from phase 2 to phase 3. It depends on all those things you just said.
Right.
So worst case scenario, build in 2 weeks. And then at least you'll know that that's my worst case scenario, which takes us into, if it's 2 weeks, what, mid or end of June? Mm-hmm. And look at where your business sector falls on our website again, phase 2. And you'll be able to figure worst case scenario where you might be able to reopen. In the meantime, get those reopening plans done. Be prepared so that when you do reopen, you can hit the ground running.
Absolutely. And the last question we have is there any training out there for businesses regarding a safe reopening plan?
Yes, and it was just recently announced by our good friends at the Small Business Development Center. They have a training program, an online webinar. And Rich, if you want to bring that up on the retail piece, there you see it. The Small Business Development Center is doing a retail business safe reopening training webinar. And that's set for May the 27th from 9 in the morning until 1 o'clock. It doesn't cost you anything. You can get the more details by calling the SBDC at 210-2515 or email them there. You can see that up on the screen. Now that's the Small Business Development Center, again, focusing on small retail business. But the Niagara County Community College Workforce Development Program also has a training program. And Rich, if you can bring that one up, that's mainly focused on the manufacturing. And that is also going to be offered on May 27th and May 28th from 8 a.m. to 10:30 and 1 to 3:30 on the 27th. And on May 28th from 8 to 10:30 and 1 to 3:30. There's a cost for this one. It's $40 per person to take part in this. And again, for more information, you can give them a call at 614-6236. So yes, those trainings are coming right up, and they're right around the corner. And if you have any questions or you missed those numbers, you can see it later on when this is replayed, or you can call our office anytime. We've got staff manning the phones. Our office number is 278-8750. 278-8750, and we'll be happy to get you that information again.
Great. And Mike, I know you're very involved with our Restart effort here in Niagara County. That's a group of many different stakeholders who are really helping to prepare our businesses and the business owners for future phases in those reopenings. What are you guys working on right now or looking at down the road? Can you give us a little update about Restart?
Sure. We've had 3 meetings already. The Restart group is a phenomenal group. I love that group. So
I agree.
Thanks to Economic Development Committee Chair Rich Andres, yourself, Becky, Doc Syracuse, and all of the private sector and other partners, the Small Business Development Center, the chambers, the companies that are involved. We've been able to put up, in fact, in our first meeting way back in April, seems like forever ago, doesn't it? But way back in April, in our first meeting, the goal was to give some guidelines to these companies so that they can begin to think where they need to be with putting together the reopening plans. That was successful. Companies got a jump start. Then we talked about the state guidelines and how to follow the state protocols. So right now where we are at is we're going to continue to monitor the upcoming phases of reopening and continue to work with our group, which includes small retail, not just small retail. We've got John Duran from the Fashion Outlet Mall on that group, and we got John Percy representing the tourism industry. So a lot of questions with regards to retail, which is why the SBDC is doing that program for retail business. But keeping our eyes focused on the upcoming phases, phase 2, phase 3, phase 4, and giving good best practices for small mom and pop companies on how they can reopen safely. We're getting a lot of questions about masks. Masks are still out there and available. Jonathan Schultz's organization has done a tremendous job getting masks out there, as has the Office for the Aging for seniors. So if you've got questions about getting masks, thank you, Rich. There's some information there up on the screen. Again, if you need more info and you didn't get it quickly enough, call our office and we'll steer you in the right direction.
Fantastic. Well, just a wealth of resources for our business owners, so thank you. Before I let you go, though, I need to ask for a quick update on Census 2020. How are we doing in Niagara County?
Thank you for asking, because we're very proud about where we are with that in Niagara County. Right now, Niagara County is currently tied with Nassau County at number 1 in the state in response rate. Our response rate is 65.7% to the 2020 census, which is amazing. Again, tied for number 1 with Nassau. So let's keep it up, Niagara County. This is all good because your response is going to be critical to us getting our share of the $625 billion in federal funding. When you compare that to the state's response rate, Becky, the state's response rate is 54.6, so we're well above the state's average response rate. The national response rate is just under 60. So we're staying above those numbers. We're number 1 in New York State. So my message is, if you haven't filled it out yet, get on there and fill it out. There's the website. Rich is so good today, isn't he?
He is,
He's
right on
man
it.
on the spot with all the good information. 2020census.gov.
Wonderful. Well, thank you again, Mike, for everything that you're doing to help our businesses. It can truly be a time that people are just needing that extra help and guidance as we all work our way through this situation. Not a lot of answers sometimes. We have to find the right person to ask.
That's right.
And get the guidance out there. But that's what your team is there for, so thank you so much for
you are
working
quite
with
welcome.
everyone. Well, this will be our last show before Memorial Day, and I know that Memorial Day is going to look very different this year than it usually does. Most of the ceremonies have been canceled, parades are canceled. We just won't be able to celebrate in the same way we usually do. We won't be seeing those giant family and friends picnics in the parks this year. So really, let's just take a moment to not forget what Memorial Day is all about, and that's when we are honoring those who gave their life in service for our country. I think with everything that we have been through these last few months, we've all kind of taken a step back and really looked at what's important in our lives and what it means to serve others and to serve your country and to put yourself at risk for other people when called upon to do so. Think about all of these brave men and women this weekend. Put your American flag outside your home. Hang a sign in your window. Just let everyone know that you remember on Memorial Day, because we can't be together to do those things that we normally would. So just take a few minutes, take a step back, remember what that day is all about. But again, I would ask you to please just be mindful of those social distancing guidelines this weekend. We know we're not supposed to have groups of more than 10 together. We still need to be wearing masks and staying distanced from each other. It's going to be a beautiful weekend. Get outside, enjoy that sunshine, get some fresh air, and just experience that feeling of being out and about, but just remember to do so safely. We want to remind you again that this is a difficult time and people are struggling, but there's help there for you, and we're all in this together. So please don't hesitate to call the Niagara County Crisis Hotline at 285-3515. That is free and confidential help that's available 24/7 and there for you if you are struggling. If you have a family member who needs some assistance, please reach out to them, especially at a time when we can't celebrate the way we normally would, and people really struggle with that. It's hard to be out of our normal routine and do the things that we love to do. So again, 285-3515. If you joined us late today, you can catch us on demand on lctv.net. We will also have the link for the replay on our Niagara County Facebook page. And we know that LCTV has been a wonderful partner. They will also replay this broadcast several times throughout their daily schedule as time allows. So thank you again for all of the other broadcast companies who are picking up our message and getting it out there to our residents. We truly appreciate it. Everyone, please have a wonderful, wonderful weekend. But for the most part, stay home, stay safe, and stay healthy.
Exercising the previous 5 years, we had spent a lot of time out in Hawthorne face to face with the team. And I know the Houston Travelers had to figure out a way to not necessarily do that as often. And so I hope the nation can look at this and recognize that this is something we're still going to accomplish. This is still something that we're going to still be successful at. And we're going to do it in the face of, the pandemic. We'll figure out a way to work through it and work around it and work through it safely. So we mentioned already that we'll continue to be COVID tested as we lead up to launch because we, of course, don't want to take that to the International Space Station. But, where there's a will, there's